So preparing home for baby. There's a couple of things that are really important. First of all is, where's baby gonna sleep? I am a big proponent for co-sleeping, and one of my biggest things that I follow is the Safe Sleep 7, and I like to teach that to my clients. So what are the Safe Sleep 7? If mom is a non-smoker, if she's sober, not drinking alcohol or using any substances, you're breastfeeding and your baby is healthy in full term, so not too small, came too early, that baby's laying on their back next to you, and they're lightly dressed, so whatever you're comfortable in, one more thin layer, thin blanket, and you're both on a safe surface. So a safe surface, whether that's co-sleeping or baby's in its own space, is something that's firm. We don't want something real soft and squishy like a flimsy mattress, real firm mattress. And when baby's not sleeping with mom, even if you do plan to co-sleep, it can be really helpful to have another safe space to put baby down, whether it's just to rest or to free up your hands, if you need a break, to make sure that that's a firm surface and there's no toys or bumpers or blankets in with them. When baby's co-sleeping, keeping the blankets off of baby. You can have them down around your waist or something, but you don't want to bring them over on baby and keep the pillows away from baby, okay? It can be really helpful to have a wrap to carry baby in. So again, free hands can be really helpful, and keeping baby close to you is going to keep them happy, hearing their heartbeat that they're used to in the womb, and keeping their temperature likened to yours. It can just be really soothing for babies, and it can be helpful for moms too and help with bonding. Another thing is, since you're having a birth at the birth center, we recommend having a car seat. And then having different sorts of clothes for baby, especially in the winter time right now. Some thin layers, some thicker layers, thin and thick blankets. Especially if you want to swaddle, having those thin flannel blankets can be helpful because they can, you can get them to stay better when you swaddle them. And we can show you how to swaddle baby if you want some help with that too. With breastfeeding, it's really helpful to have easy access shirts and nursing bras, and then also breast pads, especially reusable ones. If you don't want to have to buy some all the time, you can get organically usable ones that you can just throw in the wash and reuse, and also lanolin to put on the nipples if you have any soreness or dryness. You can also use breast milk on that too. Diapering, do you want to use disposable or cloth diapers? I do recommend people buy 1 pack of newborn diapers just for when baby has their first poops, the meconium, because it's so sticky and tarry, and it can be so difficult to get off of those nice cloth diapers. So at least having 1 pack. But otherwise, you can consider what you want to do for diapering, just making sure that you have all of those things ready, so that no one has to go to the store or go and get something right away after baby's born. You guys can just go home and rest and bond with baby. I'd also like to ask you if, whether it's during the birth, immediately after the birth, or later postpartum, if there's anything, any sort of practices, whether it's religious, cultural, tradition, or just in your family, any practices that are important to you, or things that you wish to omit that I've talked about or that you've heard about, just so that we can make sure that you have the experience that you want. Is baby finished feeding? Okay. If it's okay with you, we'd like to do the newborn exam in just a little bit. And so I know we've talked about that, but going over it again, what that entails is a head-to-toe assessment of baby, getting a baseline for their heart rate, listening to their lungs, making sure that they're clear or clearing, looking over baby's skin to see if there's any birthmarks or peeling, anything out of the ordinary. We'll look at baby's head and check for any molding and their little soft spots. We'll look at their eyes, symmetry in the eyes, symmetry with the nose and ears, a lot of symmetry with the body, to be honest. And then we will check for any swelling or broken blood vessels in the eyes. We'll check their nose to make sure they can breathe through both sides because babies are nose breathers. Now we'll check their mouth, look at their lips for any lip ties, tongue ties. We'll check the roof of their mouth and their gums. We'll look at their fingers and toes and count those. And then we check also for their palm creases to make sure they're symmetrical, and their foot creases and their leg creases. They have creases on the back of their legs as well. We'll check their bottom and their privates to make sure that everything looks like it should. We'll listen to bowel sounds to make sure we can hear their belly working now that they've eaten. Check for masses in the abdomen and the neck. We'll check for their thyroid as well. Make sure that their clavicles weren't injured during the birth. And then we'll also check their reflexes. It's a pretty comprehensive physical exam just to look over baby, make sure that we don't need to seek out any additional care for baby at this point, and so that we have a baseline moving forward. You know, we'll take their weight and their head measurements and how long they are, so over the next 6 weeks we can see how they grow and how they change. And I know that you had said that you wanted the vitamin K injection for baby. That's the one that's for vitamin K deficiency bleeding. The vitamin K helps their blood clot, so that helps to prevent that bleeding. And that's given in the thigh. We can give that after baby's physical exam. You know, we can put baby back on breast if you're okay with that. It helps them to calm themselves down right after the shot. And you know, after we give the shot, you know, we'll just keep an eye on baby for a second, make sure that they don't have a reaction. You know, you should keep an eye on the site and make sure that there's no extra redness or it's not getting inflamed, and that baby calms down after the shot. You know, they shouldn't stay riled up. Okay, so I heard that you're about ready to go now. Before we start getting everything packed up, is it okay if I go over the postpartum instructions for both you and baby? Okay, so one of the biggest things is for the next 2 days, we don't like for you to be left alone. We want someone to be with you at all times, especially when you're getting up out of bed or going to the bathroom, just to make sure that, you know, if you feel faint, you know, someone's right there. And then we will also come back a couple of times postpartum to your house for visits. We'll come back at the 1 to 2 days, 24 to 48 hours, and we'll do the heart test with the pulse oximeter. We'll do the metabolic screen with the heel prick. Currently, I don't actually offer hearing screens. We can talk about pediatrics or just going in for a hearing screen. We can talk about that at the visit tomorrow. And then I'll come back again around 3 to 5 days, and then 2 weeks, and then 6 weeks. If anything comes up, we can add more visits as we need, okay? So, temperature. This is for both you and baby. You may take yours and baby's temperatures daily for the first 3 days after the birth. Your temperature should be less than 100.4 degrees Fahrenheit when taken orally in the mouth, so under the tongue, and baby should be between 97 and 99.4 degrees when taken under the arm, so right in the armpit. If baby has a temperature outside of that window, I do recommend taking a rectal temperature, so you just stick the little metal part into the anus. to make sure that, because under the arm can be less reliable than the rectal temperature. If you don't do daily temperatures, that's fine, but at least take your baby's temperature if something seems off or baby's acting differently than you would expect. And there is a spot on these instructions that I'm going to give you. You'll get a copy of these to record you and baby's temperatures each day. You might notice a small increase in your temperature when your milk comes in. That's normal, but it should return to normal within 24 hours. So you can increase your vitamin D supplementation up to 6,000 IUs. This baby does receive some vitamin D through the breast milk. If you had a tear, you can add in 100 milligrams of vitamin C as well. Please continue to take your prenatal vitamins as long as you're breastfeeding, okay? Rest is really important after giving birth, that you take time to rest. Try to focus on just you and baby as much as possible. It's helpful to nap when baby is napping, especially when they're waking up in the night to feed. If it's possible, arranging for help from family or friends for household tasks, and if they're not available, if financially you can swing it, a postpartum doula can be helpful. You should not try to lift more than baby, not car seat and baby, just baby. For the first 2 weeks postpartum, your younger children can crawl up on the bed with you. Don't pull them up. Let them crawl up to you, and they can sit on your lap or the bed next to you, or you can just hold them while they're sitting. Try not to stand for long periods of time and remain home for the first few weeks as much as possible. Leave the unnecessary tasks for later and just focus on healing and getting enough sleep. Food, easily digestible food, specifically warming food, can be helpful after birth. Your body's recuperating and needs more calories to heal and to support breastfeeding. Having one extra snack per day can help fulfill that need. Make sure that you're getting enough and that there is a focus on nutrients, protein like meats and animal products, fats and oils, and lots of fruit and vegetables. Drink lots of clear fluids, nutritive tea like nettles, oat straw, and alfalfa, and just make sure that if you're hungry, you eat. Bleeding, it's normal to bleed for about 6 weeks postpartum. It may be similar to a heavy period as it starts, and it's important to wear pads, or adult diapers can be really helpful too. Just please do not use tampons or insert anything into the vagina. Make sure you change your pads often and wash your hands before you change them. Most of the blood that you'll lose will happen in the first day or so after the birth, and it'll slow down after that. You might notice an increased bleeding during feeding sessions and some contractions with that in the first couple of days. Normal bleeding can soak a large maxi pad in 1 to 2 hours during that time. If you're bleeding more than that, though, please call me. Passing clots is normal, especially when you get up or use the bathroom. If a clot is larger than the size of your fist, though, please call me. Your uterus, you should feel it below the belly button. It should be firm and about the size of a grapefruit. This is important because that's what's helping to control the bleeding by closing off where your uterus was in, or your placenta was in your uterus, because there is that wound there. If you notice you're bleeding more, you or someone else can massage the top of your uterus to help it firm up, especially if you notice that it feels soft. It's also important that you use the bathroom about every 2 hours so that your bladder isn't full, because that can help, that can stop the uterus from contracting as well. If you notice your bleeding picking back up after it slowed down or turned kind of brown or pink and back to that bright red, it could show that you're doing a little bit too much and you just need to listen to your body and relax and take some more time to rest. Pain. As the uterus does contract to slow bleeding and begin to return to its pre-pregnant size, it can cause some discomfort, especially as you have more children. These are often called after pains. If you need, you can take ibuprofen 800 milligrams every 6 hours, or Tylenol 1,000 milligrams every 6 to 8 hours. You can add extra calcium or magnesium supplementation. arnica homeopathics or herbal tinctures like the after ease or cramp bark, and these things will kind of help with those after pains. It's normal to feel sore and swollen on your bottom, having a little bit of a tear, keeping your legs together, having mermaid legs whenever you get off the bed and back on, avoiding stairs and excessive movement in the first weeks can help that come together and heal really well. Some people like the cold for their bottoms, using an ice pack, frozen pads, witch hazel, or herbs like calendula can help to ease that swelling. Others like the warmth, warm water in the peri bottle. If you don't have a peri bottle at home, you can use a clean Dawn dish soap bottle. You can spray the area clean after using the bathroom or before you pee. That can help release the pee as well and avoid that stinging. Make sure you use that and don't just wipe, but after you spray you can pat front to back to dry yourself after using the bathroom. You can also add some warm tea into that with some healing herbs like lavender, calendula, comfrey, or you can put those herbs in your bath too. You can take a sitz bath or an herbal bath immediately after the birth, and more than one time a day if you want. Just make sure that your tub is clean. After having a baby, some people have hemorrhoids. If you feel something sticking out near your anus, or a bulging of that area, or blood specifically on the stool you pass, or when you blot after passing stool, then you might have hemorrhoids. These can feel quite sore as well. Tux pads or witch hazel can be helpful, and make sure you eat a lot of fiber and take magnesium or stool softener, and try not to strain when having a bowel movement. Honestly, it can be really helpful just to take magnesium or stool softeners right away anyways, because it can take 2 to 3 days after having a baby to have a bowel movement for everything just to kind of get back to normal. Again, with drinking lots of fluids, at least 2 to 3 quarts of water, tea, or broth a day, fiber-rich foods to soften the stool, drinking prune juice. Just avoid taking laxatives, okay? Nipple pain with breastfeeding. It can take a few days to get adjusted with the nipple pain. Usually right when baby latches on is when it's most painful. But throughout the feed, it shouldn't persist. Allowing your nipples to dry between feeds, or adding lanolin or expressed breast milk to the area after each feeding can be helpful with the soreness or any cracking. If you have nipple pain, it's really important to make sure that baby has a good latch too. We don't want you to be in pain. So baby's far enough on the breast, they're laying with their tummy to your tummy, their head's in line with their back, they're not turned, and make sure baby's head, their nose is in line with your nipple when they go to latch. So big open mouth, nose in line with nipple, belly to belly. Engorgement, where your breasts get really, really full. This is more common to occur when your milk comes in, and it usually lasts 1 to 2 days. Put the baby to breast often. I really like to recommend cabbage leaves. You can put them right in your bra to help with the pain of engorgement and kind of pulling some of that fluid out. You can also put herbal compresses on your bottom, so you can wrap them in like dish towel or cheesecloth. So there's a recipe in here, but it just has comfrey, calendula, slippery elm, and then you just put it in there, or a coffee filter, and set it in some boiling water for 5 minutes, and then you can just put it right on your pad and then sit on it, okay? The blues. I don't know if you ever heard of the baby blues. It's common to feel a little bit sad after having a baby. For many people, this happens around the time the milk comes in. After you have a baby, there's just such a rapid change of hormones, and it can cause a little bit of mood swings or sadness. Having a lot of support around you is important. If the blues don't pass, though, and you find yourself sad all day or feeling overwhelmed, please call me. Quickly, just going over intimacy, it's really important just to let yourself heal before getting intimate again with your spouse. There is that wound in your uterus from where the placenta was attached. Doctors typically recommend waiting 6 weeks. I just want you to listen to your body. At least wait until all the bleeding has stopped. We can talk about family planning at the 6-week visit, but if you want to talk about it sooner, just bring it up. When you do resume intimacy, though, it is common to feel more dry when breastfeeding in the vagina. So using a lubricant and taking things slow can really help. I'm sure you're not thinking about that. I know. Exercise. Continue to roll over to get out of bed so that we don't strain your abdominal muscles. They did separate during pregnancy. And it can take a few weeks for them to come back together. Try not to strain the area until then, no heavy lifting again. The first exercise you do after having a baby should not be strenuous, should not be difficult. Simple walk, pelvic floor exercises like Kegels can suffice. And still avoid any heavy lifting until 6 weeks, okay? For baby should be kept skin to skin as much as possible. This helps their temperature to regulate and it helps them to bond and you to bond with them. Babies should eat every 2 to 3 hours after their big sleep. All right, so it's normal for babies after birth, they're tired, it was stressful for them too, to have one big sleep. You should rest during that time too. This can be up to 4 to 5 hours. They shouldn't sleep longer than that though for their big sleep. It's important that after that big sleep, baby feeds often to regulate their blood sugars and keep their energy up. In the first few days, the first milk in the breast colostrum, it's not of large quantity, but babies' tummies are very tiny. They don't need a lot, but they might eat often. But that colostrum provides amazing nutrition until the milk comes in. Following baby's cues can be really helpful if they're searching for the breast or sucking on their hand. Try to offer the breast. Please don't put baby on a feeding schedule. Babies will give those cues when they're hungry and their needs are really important and real. If they're sleeping past 2 to 3 hours, try waking them up with stimulation like undressing them, changing their diapers, stroking their back or their feet. Normal feeds can last 20 to 40 minutes each time. If baby's uninterested in feeding, please call. Larger babies and smaller babies tend to feed more or more often as they have higher blood sugar needs. This isn't super important, but burping babies after feeds can really be helpful. This usually takes a minute or two of just patting on the back and keeping them upright. Don't be alarmed if you don't get a burp out of baby. Some babies get gassy as well, and you can just gently massage baby's belly in a circle or pedal their legs like they're on a bike while they're laying on their back. Infant probiotics can be helpful too, especially if they've been exposed to antibiotics. Baby's wets and messes. Babies should have a bowel movement. They should poop within 1 day, 24 hours after the birth. On the second day, they should have 2 poops, and on the third day, 3 messes. After that, when the milk comes in, they'll have 4 to 6 messy and wet diapers a day. Breastfed babies may skip some days or have many messes one day, but they should always have wet diapers. When they pass urine and stool, it shows that they're getting enough to eat, as well as if they're happy and content after feeding. The first days before the milk comes in, babies have that sticky, dark-colored stool, that meconium. Once the milk comes in, their messes will start to change and become yellow and seedy. When they have those tarry messes, it can be helpful to put a little bit of olive oil on their bottom so that it doesn't stick to their skin. Speaking of their skin, jaundice, that yellow coloring that some babies get, the skin, it's common in babies and usually comes on between days 2 to 7. This is due to a buildup of bilirubin in the blood as their red blood cells change because they used to be in fluid and now they're in air, and there's a lot of changes happening in their body. This is one of them. So as their red blood cells break down, sometimes if their liver is a little immature, it'll take time for it to break down and it appears in their skin, that yellow coloring. This is normal, but if it happens before 24 hours, that would be something we would want to investigate, so please call. If they have jaundice though, putting baby unclothed in indirect sunlight, so like in a window, can help with this breakdown. Just make sure when you do this they're warm enough. Nursing baby can also help as bilirubin is taken out of the body and baby's messes. Baby's skin may take a little time to acclimate to life outside of the womb. You might see little rashes or peeling as they adjust. Because baby skin is so sensitive, it's best not to use fragrances. It's better to use oils like jojoba or olive oil to moisturize. Baby's breathing. Babies are obligated nose breathers. It's not normal for them to breathe through their mouth. They often have irregular breathing, so they'll take several slow breaths, then quick breaths, and then stop for a moment before breathing again. This is normal. What's not normal is if breathing seems difficult for them. So seeing retractions where they're looks like their ribs are pulling in, or their nose is flaring out, or grunting. They might cough and sneeze for the first few days as their lungs clear. Nursing can help with that too. Baby's cord, their little cord stump will dry and fall off. It can take 4 to 10 days. Keeping the area clean and out of the diaper, keeping it dry will help with the healing. It's normal for the stump to smell a little bit. If it appears irritated with a little bit of redness or more smelly than usual, you can add some golden seal or rosemary crushed up to the stump and clean it with rubbing alcohol until the stump falls off. Only clean baby with a washcloth, no baths, okay? Don't submerge them in water until that totally falls off. Eye discharge. Baby's tear ducts aren't fully developed when they're born, so their eyes can develop a little bit of that green-yellow discharge, little goobies. You can just wipe their eyes with a warm washcloth, or you can put a little bit of breast milk into their eyes. You can also put chamomile or calendula tea on a washcloth and wipe it. Dressing baby. Baby should be clothed in the same number of layers as you, whatever you're comfortable in, plus one more thin layer or a thin blanket. So let's go over some of the warning signs. And again, these are things that you'll want to call me immediately. I'm going to send you with all this information, and this little sheet will be in here as well, okay? So if your temperature is higher than 100.4 or baby's is higher than 99.4, or if baby's temp is too low, I want you to call me. If you have any uterine belly tenderness, unusual smelling or foul smelling odor from your bottom, or your belly is warm to the touch, I want you to call me. Heavy bleeding, filling a large pad in 20 minutes or less. If this does happen, call me, but immediately massage your uterus until it becomes firm. If you if you experience chills or aching, feel like you're going to pass out, have a fast heart rate, or if you appear pale, please call me. If you have a severe headache or pain in the stomach, legs, or chest, if you can't pee, if you have swelling in your legs, if you have red or tender spots on your breasts, if you feel you're a danger to yourself or others, please call me or 911. If you have bouts of sadness that interfere with sleep or eating, call me. If you have sudden nausea or vomiting, call me. If baby's breathing seems too fast, or they seem to be having a hard time breathing, call me. But if baby's face is turning blue or they're not breathing, please call 911. If it seems like they're really in distress, you can call me after you call 911, but please call 911. Call me if baby has a high-pitched cry, if baby's difficult to wake, is lethargic, kind of droopy, isn't nursing. Call me if baby projectile vomits, where it like shoots out a large amount more than one time. If baby has any seizures where they might be shaking, their eyes might roll up into their head or flutter, have a stiff body, or just be staring, those can all be seizures. Please call 911. Call me if there's any circumcision bleeding. If there's any bleeding at all, please call 911 if baby's bleeding. More than just the little drop that comes with a circumcision. If baby skin looks yellow, blue, or gray in color, or has any bruising, call me. The blue on the hands and the feet for a day or two, that's pretty normal though, just as they're acclimating to breathing on their own. Call me if baby doesn't have any wets or messes in the first day, or if after the first day baby doesn't pee in more than 6 hours. Call me too if baby's cord stump is really red or smelly. For moms with HIV or Hep B, it's important to keep taking your antiretroviral therapy after having your baby. It's also recommended that you see your primary care, your GYN, OB care, and HIV specialty care providers, and choose a pediatric provider and specialty HIV provider for baby, okay? All babies born to women with HIV are recommended to get medication within 6 hours of delivery. That helps protect them against contracting HIV. Usually they're given these medications for 4 weeks. Babies should also be tested for HIV within 2 days after they're born, and again at 6 and 12 weeks. For those like you with an undetectable HIV viral load during pregnancy, so that's less than 100 copies, and taking antiretrovirals, the risk of HIV transmission through breast milk is less than 1%. The World Health Organization recommends lifelong antiretroviral treatment for all women with HIV, and they do promote breastfeeding. They recommend breastfeeding your baby. So for moms with Hep B, it's recommended that babies born to moms with Hep B get the Hep B immune globulin injection, so the shot within 12 hours after birth, and that helps protect them against contracting Hep B. Mothers with hepatitis can breastfeed their children. It's recommended that women with Hep B follow up with your special care provider after the birth, whether or not you're on antivirals. It's important to monitor for any elevations in liver enzymes, as some women do develop increased liver inflammation after giving birth. All right. Can I give you